Right, we'll make a start. Hello everyone, welcome to the session on health and care. I just want to check that we have our online speakers. So this is going to be a very hybrid session because we're going to have the three of us here and we've got 3 online contributions as well. Sara and Anna, can you hear us? And
yes, hello, good afternoon, Andrew.
Hi Anna, great to hear you. And Sara, can you hear us?
Yeah. Hello. Good afternoon.
Good afternoon to both Sara and Anna. So welcome to this session. So the subject is obviously the future of health and care. We have a fantastic lineup. Sara Cerdas MEP will be giving us an international perspective on some of the shared health challenges that we face right across Europe. We're going to be hearing from Anita Charlesworth on my left. Anita is from the Health Foundation. We're going to be hearing from Dr. Sonia Adesara. We are going to be hearing from Anna Dixon, who's somewhere behind my head, who is, I think, wearing 2 hats today because she is the co-chair of the Archbishop's inquiry on reimagining care, but has also been selected as Labour's parliamentary candidate for Shipley. And then, as I said, we'll be hearing from Sara Cerdas, who is a Portuguese MEP who leads on health in the European Parliament. But first of all, as a special treat, we have a pre-recorded video message from the person who couldn't join us today because it is his 40th birthday today, and that person is Wes Streeting. So Wes has kindly recorded a message to play to kick off our debate, and then we'll be, I guess, inviting all of our speakers to respond to what Wes has to say.
Hello, sorry I can't be at this year's Fabian New Year conference. It's actually my 40th birthday. I know, I don't look it, but I'm out on the Norfolk coast celebrating. So let me just outline where we are in terms of Labour's agenda for health and social care as we enter what's likely to be the last year before a general election. People can see the state of the NHS, the longest waiting lists in history, 2 million people waiting more than a month to see a GP, and the complete breakdown of emergency services to the extent that people can't rely on an ambulance turning up when they need one and waiting more than 24 hours in A&E, no longer just a television programme, the grim reality for patients. This is the year where we have to take the microphone from the Conservatives and make sure people hear Labour's answer to the biggest crisis in the history of the NHS. They can see the government's broken it. We need to outline how we'll fix it. We've been making good progress already. The biggest expansion of NHS staff in history, funded by the abolition of the non-dom tax status, because we think people who make Britain their home should pay their taxes here too. But investment, as the last Labour government showed, though essential, is not in and of itself enough. We've got to reform the way that the NHS works because we currently spend a huge amount of money, I think among the highest in the OECD, on hospital care, which means late diagnosis, which means less effective, more expensive treatment. What we need to do is get there much earlier, faster diagnosis. That means more investment in primary care, more GPs, part of our workforce pledge, but also creating more front doors into the NHS. And we've been exploring a range of ideas from in areas where it's clinically safe to do so, people being able to self-refer into specialist services, whether that's mental health or gynecology, where women are waiting about 7.5 years for an endometriosis diagnosis, completely appalling. Also fixing the exit door to the hospital in social care because we have about 400,000 delayed discharges each month. And that broken system means that not only are patients having a miserable experience, the lowest patient satisfaction since 1997, it also means we're spending money badly. So instead of going to see a GP, which will cost around £40 for an average appointment, they end up in A&E, where an average appointment can cost as much as £360. So it's about, yes, investing more, it's also about spending money wisely and making sure that we've got a health system that's genuinely fit for the future. Making sure that the party that founded the NHS 75 years ago has a plan to safeguard it for the next 75 years. As a publicly funded public service, free at the point of use. The Bevanite principles still there, alive and kicking in the 21st century. And it's important Labour owns the reform agenda. We can't allow reform to be a word and an agenda that's owned by the right, because we know what their version of reform is. It's privatisation, it's running down the National Health Service to the extent that people give up on those founding principles altogether. So there's a lot riding on us this year, and Labour's got to be prepared to be in the debate, to start debates, to have arguments, to deliberate with the profession, and most importantly with the public, being the patient's champion. Because for all of the challenges in our NHS right now, there is a world of opportunity on our doorstep here in Britain in terms of our amazing life sciences sector, developing new treatments, groundbreaking treatments, new technologies that mean that patients going in for a kidney operation like the one I had can have it done in a day now. Remarkable technology. And also making sure that we are preventing ill health in the first place, good public health, and health in every policy right across government. That's part of our agenda, and I'm looking forward to hearing the outcome of your deliberation and discussions with your brilliant panel after the conference.
Fantastic. So we'll be unpicking a lot of that. I'm sure that Sonia and Anita will want to reflect on some of what's been heard. Health policy has been controversial. There's been a lot of debate in the just since Christmas, hasn't there, in terms of remarks Labour has been making, but also, of course, the very controversial remarks from a former health secretary about charging today. So before we do that, I think it would be really helpful if we widen the conversation out to think about this from an international and global perspective. We're so bad at insular debates in the UK, as if we have the only public health issues and the only healthcare system in the world. So it's incredibly good to have Sara join us to give a reflection on the debate about both public health and healthcare systems across the rest of Europe. Sara, would you like to make your remarks?
Hello, good afternoon, Andrea. Can you all hear me?
Yes, we can.
I'm very sorry not to be present there with you in London. For family reasons, I need to be in Madeira, but we're at least in the same time zone. So it's a huge pleasure to be here with you and share a bit what we're doing in the EU, or what are the main challenges that we're facing, but also how can we overcome them, especially in health and healthcare. So just to start, we know that there has been a lot of challenge when it comes to demographics. People are living longer, and this means that they are living longer. So patients are getting more complex as time passes by. So there has been more diseases, more therapies available, so an increase disproportionately to the human resources burden. Also, the hospital infrastructures haven't increased in size. However, the population has been growing exponentially since the mid of last century. So this is two factors that have contributed to a burdensome in the health system, but also technology and this digital transition have changed how a patient addresses its health professionals. Now, when we go to an appointment, the patient already comes with 6 different diagnoses. One of them obviously is cancer through Dr. Google. So that makes also a strain in the relationship between the health professional and the patient. So the main challenge here is how will we treat more people, more complex in medical terms, and how will we care with a burden on our resources, financial and human resources, and with more technological resources, but also making them more cost effective. So with this, I just want to share that UK's problems at the moment within health and healthcare obviously have been linked to the different policies, but it's also troubles that have been affecting European Union's different member states a bit. So this is a shared challenge that we're facing. So I have 2 suggestions in order how to address these challenges. First is something that the previous speaker has talked about, through a health in all policies approach. And in order to have a health in all policies approach, we need to tackle the social determinants of health, which are the non-medical factors that influence health outcomes. These are the conditions in which people are born, grow, work, live, and age. And this will influence greatly on health inequities, which are the unfair and unavoidable differences in health status between different groups, population groups. So, for instance, just to give you an example on what are the social determinants on health, this can be income, social protection, education, employment and job security, work-life conditions, food security, housing, basic amenities, the environment, childhood development, and so on. And research has shown that if we tackle social determinants of health, all these factors will account for around 30 to 55% of health outcomes within a given population. So if we address social determinants of health, we're actually going to have better health outcomes in regards to a population, which surpasses the contribution for the health sector. So with the health in all policies approach, we enable to have an approach that integrates and articulates these all determinants and these considerations into the policymaking process across the different sectors, and this will indeed improve the health of communities and people. I will just give a few examples because I know this is just the opening remarks. For instance, in a health in all policies approach, the way we label our food at the supermarket can have an impact on the food intake of a given population. And this will indeed then will have an impact in the health outcome of this population. For instance, air pollution. We know that if we invest in greener urban areas, there will be a greater outcome in health. We also know that 10%, we know that 40 to 50% of cases of cancer, deaths by cancer, could have been avoidable, meaning if we tackle the risk factors. We also know recent data has shown that 10% of cancers are due to air pollution. So if we have greener cities, this will not only affect the well-being of the people and will tackle cardiovascular, mental health disorders, but it will also have an impact on reducing the risk factors for cancer. So just to give you this broad perspective that we don't need to focus on healthcare to have an impact on people's health and well-being. Another point here should be the One Health approach, which is the integration of people's health, animal health, and environment. And the other response to these different challenges should be in something that also the previous speaker has addressed, in considering cost-effective policies. And this will be in investing in primary care, in investing in prevention, but not only primary prevention, but also secondary prevention, meaning diagnosing a disease in its early stages. It will provide better outcomes in regards to the development of disease. It will lower morbidity, and it will also save a lot of money to the national health system. For instance, if we tackle and the system should be not only towards disease, meaning it should not be only hospital centered, but it should be community centered. And with this, a greater investment in primary care should be done. And if you allow me, and being a medical doctor myself, investment in its one of the center pillars of any healthcare system in the world, which is the health workforce. We know that it's difficult professions, and they need to have better support. And I know that the UK is struggling with some problems at the moment that has been an outcome of decades and decades of disinvestment in the NHS, especially in its human resources, but that's also something that has been affecting a bit the different systems across the member states in the EU. So this should be, just to conclude my opening remarks, this should be the focus. An agenda that focuses on the people when it comes to its health status of the population, improve a lot the accessibility in health, but also tackle the social determinants of health. This should be, in my view, the left's agenda for health and healthcare, and not only in the UK, but if you allow me, in the EU. Thank you very much.
Sara, thank you very much indeed. That's given us a brilliant framework to think about our discussion focused on the UK. And I'm now delighted to turn to Anita Charlesworth, who is from the non-politically aligned Health Foundation. Anita, to share with us what you think the left's priority should be for health and care.
Yes, and I'm going to focus, I think, on the bit that a lot of people don't want to talk about, which is the investment part of things. Because I do think it's really important, I think, to start with where we are and how we got here. And obviously, COVID has been an enormous shock to our health system. It's been an enormous shock to systems across the country. But actually, NHS and social care system were struggling immensely before COVID. And arguably, the UK found itself less able to manage COVID effectively because we fundamentally lacked capacity in our health and care system. And we also, I think, managed our health and care system in a very short-termist and crisis avoidance approach rather than planning and preparing for the long term. And an example of that is over the last decade, not only has spending failed to keep pace with the needs of the population, but actually the areas of spending which have been cut most are the areas of spending which are critical to sustainability. Prevention, so spending on public health interventions fallen by a quarter in real terms per head of population. Investment in capital facilities. We have a £10 billion backlog maintenance in the NHS. What that means often is you might have a whole team ready to do a day's sessions in the theatres with patients brought in, ready to have operations, and suddenly it's cancelled at last minute because equipment breaks down. That's consigning the system to inefficiency as well as really impacting on patients, and a system without enough workforce and workforce shortages growing, and increasing reliance on overseas workers, and in particular post-Brexit, a reliance on staff coming from countries which really cannot afford to lose those staff, and big issues about whether or not we're actually adhering to ethical recruitment. So if this was a decade in the making, I think we need to be very realistic that it will probably take a decade to fix. And I think one of the things that's incredibly important about how we go about developing health and care policy for the future is that we take that long-term view, and we're honest, and we think therefore about how to build a system for the long term, fixing the fundamentals, and fixing the fundamentals not so that we have a system that is perfectly designed for 20 years ago, but fixing the fundamentals so we have a system that is well designed both for today, and this is the 75th anniversary of the founding of the NHS, but is really thinking about what the NHS will need and care system will need in a decade or two. And I'm afraid that that does mean that we are going to need more capacity. You know, we are just, when you look compared to other countries and compared to the needs of our population, and this is a decade in which the projections are hopefully that we will have the numbers over 85 increasing by a third, that we'll have the number of people at the end of their life, which is a period where you typically need a lot of health and care, increasing by a fifth. I mean, these are good problems to have. These are what society exists to do. Yeah. But what we haven't done is prepared for that. So if you look at countries like Germany, they started thinking about how to deal with the ageing population in the 1990s, and planning for that. So we are going to need, I think, to invest money, particularly in capacity, and that is the workforce. And obviously, Labour has talked a lot about training new workers. That's absolutely right for the reasons I've said. It has said very little on retention. And I think retention is really critical. Said a lot about training healthcare workers, but not very much about the social care workforce. And the social care workforce is actually is reducing, and it's a really important issue, not just for access to services, but actually there's a really important social justice issue with social care. A quarter of the people who are on 0 hours contracts work in health or social care. Yeah, and these are people on very low wages. But so invest in the workforce, but also actually we do need more beds, more primary care, more diagnostics. It's across the whole system. So reform is great, reform is needed, but actually there's a big dollop of investment before you can begin to think about reform.
Thank you very much, Anita. Rachel's not in the room to hear that. The Fabian Society is carrying out a review for Wes on adult social care, and basically the messages you just said about the whole and healthcare of the health and care system absolutely chime when it comes to social care, workforce being absolutely critical, and a long-term 10-year approach, including an acceptance of increased investment, absolutely crucial for social care as it is for the whole system. Let me turn to Sonia Adesara. You're a practicing doctor, you're a commentator, and a former chair of the Young Fabians Health Network.
Thank you very much for having me. So I thought I'd start with telling you a conversation that I had with an elderly gentleman this week in my clinic. So he asked me, could I help him bring forward his wife's hip operation? It was scheduled to happen in about 10 months' time. And then he started crying. He told me that his wife was in severe pain. She was becoming increasingly debilitated. She'd got to the point where she couldn't leave the house. He was having to do everything for her. He'd become so desperate that he'd looked into trying to see if he could get the operation done privately, but this is an elderly couple. He said he simply couldn't afford it. And I mention this because, they say the NHS was created to take away the indignity of sickness. But where is the dignity in that? So the starting point of our conversation today is that it's not good enough, right? It's not good enough that 1 in 10 people have been forced to go private in the past 2 years due to delays in getting care. It's not good enough that an estimated 300 people a week are dying due to delays in emergency care. It's not good enough that over half of our maternity units in this country have been rated inadequate by CQC. And funding is core to that, as Anita said, so I won't reiterate what she said. But there's other things that we need to address as well. We need to address structural problems in the NHS. For too many people, when they're, despite the fact that we've got a national health service, when they're using the services, they find the service to be disjointed, fragmented, not working well together in a integrated manner. We have to address cultural problems in the NHS. And I believe the consequence of, the past few years when we're trying to deliver care in increasingly unworkable conditions is that poor care at times has been tolerated and even normalised in some settings. And then we also have to understand that, and I need to mention this, that the health needs of the population and also, the public's expectation of healthcare has changed significantly. And it's changed significantly even from when Labour was last in government. So I believe, we can't, ourselves, the public, can't simply be taking the NHS to back how it was. We need to have the ideas, and we need to have a vision of how we're going to transform healthcare to make it fit for the public's expectations. And I think sometimes these conversations about, we've had lots of conversations in the years about the NHS, they can be quite negative. You know, the NHS is in a really difficult position, but I think also this should be a positive conversation. You know, particularly for the policy geeks. You know, we are the Fabians. Actually, there's massive potential in the NHS that we can unlock. You know, look at data, for example. You know, we have because we've got this universal health system, because as a GP I have to code literally everything, there is a massive, rich set of data there that if we have the right policies, if we have the correct legislative framework in place, then we can be using that data for the benefit of us all. And then look at like health tech, life sciences, industries that we have here in the UK. If we have the right strategy to invest in these industries, build up the links with these industries in the NHS, then we potentially, the UK could be world leaders in innovation and healthcare delivery. And then thirdly, you know, touching on what Sara said, if we want to improve the health of our nation, then we need to be thinking about policies outside of the institutions of the NHS. Right? And the health of our nation is not good. Right? A third of our children are growing up overweight or obese. The gap in health between the wealthiest and the poorest in our society is getting bigger, not smaller. We're increasingly seeing chronic health conditions in younger people. So we need to be thinking about, as Sara says, thinking about how do we tackle the food industry, thinking about urban planning, thinking about transport infrastructure, thinking about air quality, thinking about the policies that we need to create the conditions in our country that allows good health to flourish. And then finally, you know, I want to take it back to what I mentioned at the start about dignity. And I know everyone in this room knows this, but you know, there are too many people, elderly people, but also adults living with disabilities who have been denied their dignity, denied their autonomy due to the fact that we have a completely dysfunctional care system, a social care system. So when we go into the next election, Labour Party, we need to have ready the plan for the NHS, we need to have a plan to improve the nation's health, and we have to have a plan for social care. And our promise to the public has to be that no one in our country, if they need it, no one should be denied that dignified care. And we have to be ready to deliver that and deliver that fast, because the British public deserve better.
Thank you, Sonia. Thank you, Sonia. And your closed on care is a perfect tee up for Anna, who has been leading the Church of England's work on reimagining care. Anna.
Thanks very much, and good afternoon. It's really great to join you, and thanks for making it possible to join some of the earlier sessions, which I've been enjoying. So before I come to care, I do just want to echo some of the points that have been made, that I think the left's agenda has to tackle health inequalities. It's a blight on our communities. We can't build a healthy economy without a healthy society. And so it's been really encouraging to hear John Ashworth, Rachel Reeves talking about the importance of health, and we've heard about health in all policies. We've also clear that for, in a way, care to function, for the NHS to function, we've got to strengthen primary and community services and draw on the skills of the multidisciplinary team of all the professionals. And we've heard a lot, I think, already. We've made strong commitments as in terms of Labour to expansion of the workforce, but it really is critical that we look at retention. And as has been said, that is as true in social care as it is in the NHS. And that is about paying conditions. People are exhausted, people are burnt out. And so we have to, as well as training a new generation of doctors, nurses, midwives, we absolutely have to look at how do we retain some of the fantastic skills, experience that we have in the workforce through flexible working, but also through good pay, and making sure the conditions, those wider conditions in which people are working, you know, when half the staff vacancies in a care home, that is not an environment to provide good care. So we have to address that. So people have been talking about a vision, and that is exactly what the Archbishop's Commission will be publishing on Tuesday. So this is a preview that I'm able to give you. And I suppose what we're really setting out is that long-term vision, at least 10 years, at least 2 parliaments, for us to move towards something that provides a much more universal entitlement. In a sense, social care is the unfinished business of the welfare state. We protect citizens from the risk of ill health, but we don't protect them from the risk of disability or old age sufficiently in this country. And in reimagining care and support, we are really arguing that we have to rethink our attitude, not only to care and support, what it is, what we understand it to be as something that enables us to live a full life, but also something that affects us all, that it is universal, that at some point in our lives we will either need care or be caring for someone else. So we have to shift an attitude from something that's about them, about other people, about vulnerable people, and get away from that language and talk about us. I think we also, as part of this, need to recognise that care and support are important in their own right. I think there's been a tendency over recent months in particular to sort of see care as fixing the NHS. No, care is about giving those of us with disability, those of us in old age, the ability to continue to live a good and full life. So what we are calling for in the Commission, and I think it's going to be very interesting, Andrew, to see your work coming out shortly, I hope, where you'll be looking in more detail at National Care Service. But how do we rebalance the roles and responsibilities of the state on the one hand, communities, families and individuals? People at the moment are confused, the system is complex. It's really important that we help people to be clear, what can they expect, what are our mutual responsibilities? So we are saying that actually there does need to be a radical redesign. This isn't about tinkering about the edges. So I think in terms of, Labour, a Labour government that I hope to be a part of, at least I hope to be elected as MP for Shipley. I hope that we will take bold steps, the bold steps that are needed to ensure that we all have the care and support we need to live a full life. So I suppose, as we did when we came in, we created the NHS after the Second World War. I think somebody was also likening the state of the country now, both post-COVID and post this period of Conservative government. And so I look forward, hopefully, to being part of a Labour government that can be as radical on care as we have in the past on the NHS.
Brilliant, Anna. Thank you so much. We're going to go over to the audience. So questions from all of you. Let's see some hands. Let's start with the woman there. And then I can't see, there's a man in the back, yes. In green jumper. Yeah. And then we'll go for the middle. So.
Oh, thank you. Hi, Councillor Adesara from Hackney, wanting to ask what Labour are planning to do about the two-tier system around fertility issues within the UK. Currently, 3.5 million people are affected by infertility within the UK in each year, and many of them, 65% of them, are having to self-fund treatment. What we are moving to in this country is some people being unable to try for the right for a family and some people being able to afford this right. Labour needs to step in now before it's too late. What are we going to do?
Thank you, Anya. Towards the back, green jumper, yeah.
Thank you. I'm Ayo Janaku. I'm a GP. I'm also involved in training the future generation of GPs as a GP training program director. And my question is specifically around retention in primary care, because I do agree with the panel member who said that there hasn't been enough focus on retention. I'm really interested to know what the panel thinks Labour's policy should be when it comes to retention, because actually some of the policies that we've announced around investing in primary care aren't particularly new. I remember the Fabian pamphlet on challenging the citadel, written, co-edited, I think, by Sara Cerdas, who's now a Labour peer, which talked about moving things from the hospitals into the community. It's been over 10 years now, in fact 20, that the Labour Party and sort of the community more broadly have been talking about doing this. And actually, I just wonder what Wes means when he talks about investment. How exactly is Labour going to ensure that we not only double the number of medical students, but actually retain those who enter general practice?
Go ahead. Yeah, wait for the microphone so the online participants can hear you.
I'm Mark, from Chair of Epsom and Newell Labour Party. Wes Streeting's talked a lot about reform, and I think we can all agree getting rid of bureaucracy, unnecessary bureaucracy, is absolutely correct. But wouldn't also a good policy be something along the lines of getting our spending, health spending, back up to EU average levels, which Blair and Brown did, leaving the NHS, as some would say, the best public health service in the world?
So reform and more money. Great, so those are three questions. We'll come to more in a moment. I'm also keen to hear the panel's reflections on the announcements Wes has made over the last fortnight on the role of primary care as well. And Sonia, as a GP, can I ask you to respond to those questions first?
Yeah. So firstly to Anya's question, you're completely right. There's a postcode lottery with regards to fertility. So depending on where you are, your access to what you can have on the NHS differs. And also it's very expensive. And, we've got this situation that, do we want to have a situation where only wealthy people are able to access fertility? It's actually quite dystopian and really uncomfortable. So absolutely. And I think sometimes we can hear people speak about fertility in quite a degrading way, as if it's like a lifestyle choice, when it's and I think we need to know that's not correct, and we should have fair and equal fertility treatment across the country. So that's really important. The second question was about from AO about primary care and about retention. This is a huge problem, and we have GPs leaving the profession. We have GP practices closing across the country. So in my area that we've worked in the past year, I think there's been 2 practices that have closed. So that's in an area, a community losing their practice, and that's because GPs are leaving, and GPs are leaving early. And it's happening for a number of reasons: stress and burnout of GPs. GPs over the past 10 years, we're having we've had our funding. So CCGs we've had our funding cut. At the same time, we've been asked to do more and more. So that's why the day-to-day care, the day-to-day practice is becoming increasingly intolerable for many GPs. And on top of that, we do get a lot of negative coverage in the press, and that can lead to, and also we're at the brunt of it. So if people are getting bad care from their hospital or waiting for longer term appointments, it's the GP practice, it's the secretaries, it's our reception staff who are getting that brunt of that anger and that frustration. So we do need to be thinking about how we invest in primary care to stop GPs leaving, because it's going to be a worsening problem. And then the last question about funding, yeah, absolutely. I think I got this from Anita's work, that in the 10 years preceding to the pandemic, the UK per capita was spending 18% less than comparable European countries. 18% less. That's massive. So there's no wonder we're struggling in the NHS, and we're trying to, at a time when our health needs are increasing, we're doing so with less and less money. And things have been cut and cut and cut to the bone, and at some point things fall apart, and now we're seeing things fall apart in the NHS. So absolutely, funding is really important, and the Labour Party needs to be bold in saying that.
Anna, could I turn to you?
Yeah, sure. I won't pick up all the questions. I mean, on that last point, I think it's really important, as Anita said, that we're clear that there is going to need to be a significant amount of investment, and the proposals that we're putting forward about social care will need investment. And I think the question is, we mustn't always prioritise the NHS and keep saying, how are we going to fund social care, and tying the funding of social care to some specific hypothecated revenue raising. I think we've got to get away from that, make the argument as to why both health and social care need investment. And actually, I would argue that it's about also some reallocation. I think we've got to boost care spend relative to health spend. So that's got to be a priority for investment, I think, in the early years of a Labour government. In terms of retention, I think we've got to recognise as well that there is still an inverse care law, that there are more GPs in wealthier areas, and we still have poorer areas that are under-doctored. And so not only looking at overall issues of retention, but particular issues about how do we retain GPs within those communities. There are some great examples. I went to Bevan Health in Bradford, where they have a very different model and a different setup. They're effectively a cooperative. They're delivering care to refugees, the homeless, street workers. We maybe do need to have some different models, go back to some of the health centre type models that we have in those areas. We already see a lot of salaried GPs, but we also do need to, where the partnership model is not proving attractive, where people are retiring and there are not people coming forward, we do need to at least have a discussion about what might sort of take its place. But I think that is a discussion that I understand, Wes and the Labour shadow team want to have with the profession, with practices, to understand how can we make it more attractive to come into and stay in general practice. Great.
Anita, could I turn to you?
Yeah. So I'll pick up a couple of things. I agree what people have said, so I won't repeat those. I think there's a very interesting thing that Labour needs to think through a little bit, that's prompted by your point about fertility, which is the balance between a national offer and devolution. And this is a real tension, I think, in our system. There's a lot of interest in devolving services, the ability to tailor what you're doing to local communities, to join up different services, to spend the public pound in an area better. And there are very good reasons for thinking we're an over-centralised state, too distant from communities, and we run our services in silos, which don't really work for real human beings who need to live their life holistically. Against that, people feel very strongly and appropriately that we pay our taxes nationally for a national health service. And we have set up, and one of the things that the UK can be immensely proud of, and it was the last Labour government that did this, the National Institute for, NICE as it's called now, which tries to set national standards for what treatments should be available on the NHS, and they're very clear about what infertility services are cost effective. And I think people don't feel that if they pay the same taxes in Bradford as they do in Blackpool, that actually they should get a different offer when the evidence on what is effective is consistent across the two. So how to navigate that desire to localise services, to devolve, to allow local discretion, with the important need, and this is very true as well for social care, and lots of problematic stories about people not being able to move because they're worried about losing the offer. The other thing I'd say on GPs and on primary care is there are a couple of areas. So I do think it's quite the most important thing for retention, just to mention, is people's ability to do a good job. So the thing that makes people leave in the main is that values conflict, where they think they can't do a good job. So I think what's really critical to focus on here is that actually there isn't a conflict in the main between staff and patients. No conflict at all. Patients want good care, and the most important thing to staff is that they can deliver good care. So I think being very clear about you're going to be able to fix everything on day one, but providing that vision that shows for both patients and staff that it's worth hanging in there, things will get better, that there is a plan, is actually really, really critical for retention. And also the other thing is the future of primary care has got to be increasingly part of an integrated offer, as you were saying. And one of the things we haven't talked about is the very important role that potentially areas like community pharmacy could play. And there are lots of opportunities to bring services together. And someone mentioned Aradazi, and I know what was it, 2008 polyclinics? Anna, I think you were involved. Yeah. There was a really good idea at the heart of that if Labour were prioritising a capital investment programme, it might want to think in particular about integrated settings that cover both health and social care, prevention, particularly in the areas that are underserved. That would seem to me to be something that if I were advising, I'd have quite high on the list.
Brilliant, thank you, Anna. And what you just said about local versus national tension is at the heart of the work that the Fabians are doing to imagine what a national care service could be, trying to find something that is locally delivered, tailored around the individual and their desires, but also has more national consistency. And we hope we come up with an answer, but no one's managed to for the last 60 years, so we'll see where we get. Sara, could I turn to you? And you've heard of quite a UK-focused debate for the last few minutes, but I think there are a lot of echoes with the experiences of other countries. Do you want to come in with your remarks?
Yeah, thank you. Indeed, there has been obviously a UK perspective, but what I mostly reflect on is that it's not only a UK problem or challenge. This is something that's affecting a bit all over Europe. I had the chance and the honor to negotiate the European Union's Programme for Health 2021-2027. And even then, we already knew and that we had to get a progressive mark there. And I'm very glad we managed to get the majority for that support in regards to having a health in all policies approach, but also something that was widely spoken about here, which is primary care, and how we should have more suited public health interventions. So in that program, which is called the EU for Health, we have an important part, which is preventing disease and promoting health. And also, I just want to remark that this is not just about feelings or what's our agenda, that we think it's better than the others. Obviously, it's better, but it's evidence-based agenda. This is science. Science tells us that for each pound we invest in long-term public health interventions, we have an outcome of 14 pounds in return. So that's huge. And we're talking about that investing in health, investing in public health interventions will actually make our populations healthier with better health and well-being, but it would actually save us money. So I wish all the best for the Labour Party there in the UK, and I really hope, for the sake not only for the NHS but also for the health of Britons, to have the Labour Party accomplish its goals for the next elections.
Thank you, Sara. We've got time for just one round of very quick questions. I'm going to ask both the panellists and you to be very fast. So let's start with that woman there, and then man back, and then sorry, colourful jumper.
Thank you. So I agree, as I'm sure everyone in the room does, that we need a huge amount of investment in the NHS. We need more beds and so on. But we also need to accept that there is rationing going on in the NHS at the moment at a local level, and we need parameters around that. There are some things the NHS is spending money on that it probably shouldn't. I know there's 2 operations I've been offered that really are purely cosmetic on the NHS, and I think we need to have parameters around it so we're not hemorrhaging money.
Great, and then at the back.
You know, I'm speaking as an old, regular patient at various hospitals and so on. Let me just share 2 relevant facts here. I'll be very quick. One, yeah, this is a question. I had to go for a blood test. I live in Haringey, next to Hackney. I was sent to John Scott's place. Very quick appointment. I went there and they told me that no, they can't give me the blood test, even though, okay, let me put it this way. New Labour came, spent a few billions on joined up health service. That bombed. And as we are speaking, there is no coordination. Everybody has been talking about a centralized health system. It doesn't exist. There are some hospitals, some services, some blood places that are completely underused, and others that are overused.
Great. Okay, no, that is your question. Thank you. So how do we coordinate and avoid inefficiencies in the service by better joining up? And then we've got the final question, is this man in the 3rd row. I'm sorry to be brutal, but it's the final round of questions. Yeah.
Thank you. Hello, my name is Philip Pearson. I'm a respiratory physician from Northampton. Hello. Thank you to my GP colleagues, without whom I could not possibly do my job. Quick question, and I'll allow the chair to say whether I'm allowed a plug or not. Question then, should we go further on tobacco control and follow New Zealand and Finland in banning sales to those born after a certain date?
Okay, 10-second plug.
10-second plug. Fabian Health is being rebooted under Dr. Luke Davis. We currently have about 6 members, of whom I'm the only clinician. I'm feeling a bit lonely. We also need other normal people to join so that we can develop a proper health policy, please.
So we'll send an email to all members promoting the Fabian Health Policy Network. We'd love you to join. Right, so those were the final questions. I'm going to go around and ask each of the panellists to make a very short closing remark, responding to any of those questions and wrapping up the session. Anna, could I start with you?
Yeah, I'll just pick up the one about the lack of coordination. I think it's absolutely true that there is a lack of coordination within the NHS. There's a lack of coordination between healthcare and social care if you are a user of both. And if you're needing care and support, there's a lack of join up with your housing support, your employment support. You know, we are human beings. We have multiple and complex issues. We need the services to make that a lot easier to join up. At the moment, we or our loved ones do the navigating, and it's really hard work. If you're a carer, you're spending a lot of your time fighting to get access. It should be a right, not a fight. And I really hope, as I say, that as part of a Labour government, I can play my part in realising the vision that I've spent the last 18 months with colleagues putting together for a system of care and support that is much more universal, and where all of us with disability and into our old age can be confident that we can continue to live the lives that we want with the right care and support. So I'm not going to answer all the other questions, but thank you for having me join the panel.
Great, thank you. And Sara, could I ask you to respond to the questions and I close the session from your perspective?
Yeah, I would like to reflect on tobacco control, and I would just like to make this remark. What we have done in the European Parliament, the right has asked for a beating cancer plan in the EU, and rightfully so, because it's the second cause of death in the EU. However, when we went to control on the known risk factors for cancer, namely tobacco, they were very no. So I would just like to reflect on this and actually just put it out there that it's actually up to us with the most progressive agenda to actually make this control those that are the non-risk factors, not only for cancer, but also for other non-communicable diseases. So I'm in favor of having stricter rules, and actually in Portugal, I'm very glad that we're going through in that direction.
Thank you, Sara, and thank you for joining us for this session. Sonia, can I turn to you?
Yeah. I think to answer your question, yeah, I agree, and I think this comes back to what we were saying earlier about sometimes when decisions are made nationally versus locally. We were talking about this in our clinic yesterday. We're having to put on an extra service, which we don't think is necessary, but it's because we've been given funding nationally to provide that service, and it's taking away one of our GPs. So it's like a national versus local. I think there needs to be more power locally to decide about what we should be commissioning for services. I'm going to go to your question because I love this question. I don't know if everyone knows, but it's like in New Zealand, they've basically made it, they've put this policy in, which basically, if you're being born now, you're never, ever going to be able to buy cigarettes. And I like the policy in principle, and I think it's good that we're educating people about tobacco, but I am against the policy because I think what we learned from drugs and recreational drugs is that just making something illegal to buy doesn't stop people from having it and using it. So I think it's a difficult one, but I'm just going to turn that question around, and I think the way we've looked at tobacco and the tobacco industry, I think we need to be looking at having that same approach towards junk food and unprocessed food and sugar, and thinking about how we target the industry from food labelling, from how we tax tax the food industry, because obesity is going to be causes such significant morbidity and mortality in this country, and it's increasing, not decreasing. We know that the harm of obesity has on people's health, and we know that it causes premature death, but we haven't done enough, and the industry knows that, and the industry hasn't done enough to address that. So I think Labour Party should be thinking about how we force the industry, in the same way that we force the tobacco industry to make changes to make the population healthier.
Brilliant, thank you. And then final wrap up to Anita.
Yeah, I want to support focus on efficiency and using resources well, for two reasons. One, it's the right thing to do, because the health service and the care system does cost an incredible amount of money. But secondly, also actually, because it's actually really important part of winning the argument for investment and sustainability. Because when people see and experience poor use of funding, actually, for them, it colours their whole view of the system. So I don't think that people should see kind of efficiency as a side issue. It's critical to winning the debate, actually, for investment in health care system. The second thing, just briefly on the prioritisation point, is the evidence on this is actually, it is really important, and it's really important for the reasons that Anna was talking about inverse care law, and the paradoxical fact that 75 years after the founding of the NHS, actually we still have people, the most disadvantaged and lowest income, getting worse access. And all the evidence is that when services are constrained, you have to prioritise. Then things like your ability to advocate for your own care, to manage and navigate the system, come to a premium. And the more the system is opaque, the more the premium is on individuals' ability to work that system. And that creates hidden disadvantage. So being very clear is difficult, but actually it's really quite important for being fair.
Brilliant moment to end on. Would you join me in thanking all our guests online and in person?